Okay, so now we're going to do the lower legs. We're going to do the quads. Make sure you do long sweeping motions. If you have a specific spot, you can focus on it, but always sweep the entire muscle group. In this case, we're going from the knee to the hip, and we're going to get into the IT band, which is on the side of the leg. Once again, that extends from the knee all the way up to the hip, and we're also getting some glute muscles there. So you're going to be overlapping muscle groups. Once again, long sweeping, and then you can focus on a specific area. We're going to do the hamstrings, going up into the glute muscles, from the knee to the glutes. And you can do some squeeze release of the muscle groups while you're doing this, by the way, neuroflexation, where you squeeze the butt and the legs as you're doing this therapy. That helps to release some of the tight tissue. You can do this at all times. Squeeze the butt, release. We're going into the sacrum area, the SI joint. The sacrum is huge. Make sure you get that. We're going into the psoas muscle, which goes from the top of the hip into the lower spine. And we're also going to do some groin muscle work. I play tennis. All these areas around the hip, all the muscle groups get tremendously stressed. From the groin muscles, the psoas muscle, the IT, the quads, the hamstrings. Now we're going to do the lower lumbar area. And of course, we're going along the spine here. It's very important to really try to traverse the entire spine. Right now we're doing the muscle groups in the lumbar, lower thoracic. You do the entire back region. Just reach back there. Again, finding specific spots, but doing those large sweeps. For the clavicles, for the scapula and the upper spine, reach back from the top. You can really get some good work in this area. If you have someone to assist you, that's great, but you can reach back yourself and do this work. And remember, the dual motor vibration machine is really potentiating this release. Make sure you cover the entire spinal region. We're getting the upper scapula, some traps up there. You can also, once again, squeeze, release, move your shoulders. You can also hold on to the strap while you're doing this to get extra vibration into that area, the arm straps of the vibration machine. So if you have somebody helping you, it's easier to do the squeeze release and do some stretching and movement while the person's working on you. Now we're going into the neck region. You want to sweep all the way from the upper thoracic into the cervicals, into the occiput, and along, all parts of the occiput there. And then we're going to also get a little into the parietals. You really want to get the bones of the head. The bones of the head can affect the neck. The temporal area. Oh, be careful. This is sensitive. Use the rubber tip. Now we're going to the scalene muscles, the thyroid area, which you call the throat diaphragm area in craniosacral therapy. Be very careful. Go very lightly. You're releasing a lot of connective tissue in that area. Now we're going along some of the shoulder joints, clavicles. They're all interrelated. The whole cervical region has a lot of tissue that winds around the clavicles, from the bottom of the occiput, all around the arms and shoulders, etc. It's all interconnected. Now we're doing the lower arms. You can flex your wrist to stretch the muscles, and there's a lot of tension we hold there. If you have carpal tunnel, you want to make sure you're working this entire sweeping of the arms, from the upper arms down to the lower arms, and to the clavicles and the region between the clavicle and the upper shoulder region there. So you really got to think big sweeping movements. You can do the hands with the rubber tip on the fingers. This feels fantastic. And you can do your wrist. Just flex, always flex to assist the release. And you can do the squeeze release technique also. This is obvious. It's easier to do that when someone's working on you. Into the elbow area. I'm always thinking meridians when I'm doing this, but we'll have a little segment coming up on some of those meridians. Alrighty. So now we're going to do the sternum. There's a lot of kidney points in the sternum, a lot of tension held in this area, a lot of fear issues, protection. But basically, you're going to feel the tension, focus on that whole sternum area. The side of the ribs holds a lot of tension also. And we showed this also reflecting into the heart. You can do the heart chakra. The whole sternum area does affect the movement of the upper shoulder girdle. So you move around, you're really going to be moving around doing this therapy. I'm jumping up to my head. While you're working, you might feel the tension show up in a different part of the body. Just jump there and follow the path, whatever's showing up. You're going to get a lot of potential release here, so your body's going to be saying, me next, me next, me next. So just pay attention, listen to your body. Also, some emotions might come up. And it's very important. This is a great time to let those subconscious memories come up. And if you start jumping around through different ages in your life, you're doing a great job. You're actually letting these stored somatic memories come up and come out. So this is a great time to do that work. So play with it, people. Again, contact me, Andrew at Boozy Water, if you have any questions. And enjoy this therapy. Thank you.